Hi, I'm Brian Miller. This is my patient Jacob DeSantis, and we are going to do the abdomen exam today. So first I'm going to do my inspection, look for hair patterns, look for any discoloration of the skin. I also want to see if there's any masses present or growth abnormally. Next, and what I first want to do is auscultate. And I'm just going to go over the abdomen with a diaphragm. And here I want to go 2 to 5 minutes at each spot in a clockwise position. If they did have pain, I could do it furthest away from the point of pain. But for time's sake, I'm just going to do a quick one. Next, I'm going to use the bell and listen for bruise, like friction rub of the liver. Or I could do it of the spleen as well. While I'm here, I might as well do the arteries, so the aorta artery, the renal arteries, just lateral of the umbilicus, the common iliac, and the femoral arteries. And I'll do skin on skin for that. Next, I'm going to do percussion. And first I want to percuss the liver. So I'm going to start just at the line of the nipple and percuss down until I hear a dull sound. And then I'm going to go left of the umbilicus and percuss up. And this would be the mid-clavicular line. And I want that to be between 6 and 12 centimeters. I also want to do the lateral side and find that. Then I can go over and do the spleen as well. And next I could do palpation. So first I am going to palpate softly, superficially, in the abdomen in a clockwise position. And then I'm going to get deeper as I go through.
Intramural.
And then I would like to have my patient breathe in and then breathe out as I dig my fingers down and palpate for the liver. I'm also going to palpate for the kidneys on each side. And I also could try to palpate for the spleen, but that won't be felt unless it's enlarged. Next, what I'm going to want to do is check for any appendicitis or diverticulitis. And so I could press on the lower right quadrant, and if he had, it'd be McBurney's point, and if there was pain, it'd be indicative of appendicitis. I'd also go to the left lower quadrant by the umbilicus and press for pain. If that is a rebound pain back to McBurney's point, that would be Reverin's test, and that would be indicative of appendicitis as well. Next, what I want to do is a couple of special tests. And that first I want to do the aorta, and it should be no wider than 3 centimeters. And for that one, I don't have to do the other arteries, just the aorta is my main concern on that one. Next I'm going to do some special tests for also the appendicitis. So first I'm going to have Jake lay on his right side, and this would be a psoas test, which would be an active test. So I'll have him extend his hips back and then resist my hand movement. And if he gets pain in McBurney's point, that would be indicative of appendicitis as well. Next I'm going to do an operator test, and this one is just the obturator. I'm going to do passive external rotation, and if that causes pain in McBurney's point, that would be appendicitis as well. Other than that, that would be about it, and that completes the exam of the abdomen.